May I call on Mrs. Adesimo Okiri, who is going to moderate this session. Let's put our hands together for Mrs. Okiri. Let's keep clapping. Let's keep clapping. Mrs. Okiri, or you.
Good morning, distinguished ladies and gentlemen. All protocols to be observed. It's a pleasure to be here today. And honestly, the topic couldn't be more apt. COVID-19 was a huge crisis, affected productivity everywhere in the world. But there must be, we believe, some silver lining that will impact the healthcare system of Nigeria going forward. So today, we are going to be talking about healthcare in Nigeria beyond the crisis, beyond COVID-19. How has the events of the past 2 years helped to enhance, or will help to enhance productivity? I have a very distinguished panel. We're very, very fortunate to have experts that will educate us and I believe also position us to take advantage of the opportunities that the coming years will bring. Without further ado, let me introduce our distinguished panelists and invite them up to the stage. I will start with the Honorable Commissioner for Health in Lagos State, Professor Akin Abayomi. You're welcome, sir. Joining us virtually, we have Dr. Ifedayo Adetipa, who is the Director General of the NCDC, that's a tongue twister, the Nigerian Center for Disease Control. Dr. Adetipa, you're most welcome. We also have here Dr. Adeyemi Johnson. He's the MD CEO of First Cardiology Hospital here in Lagos. You're most welcome, sir. We're talking technology, so the final panelist I'm going to call to stage will be well known to many of us in the healthcare sector as one of those who are in the forefront of trying to take advantage of technology in improving Nigeria's healthcare system. So please permit me to welcome Dr. Debo Odulano, the CEO and founder of Doctora. It's incredible that now restrictions are being lifted across the world and life seems to be heading in the direction that makes us to believe that we'll soon have our normal lives back again. So is the crisis over is the first question I would like to ask. From where you are sitting, from your perspective, can we genuinely say that COVID-19 crisis is over and we can all go back to the way we used to live? Honorable Commissioner, I'm going to give this to you first to talk us through. What is the state of things? Is the crisis really over?
So while I will answer your question in two ways, COVID is not over, but I believe the crisis should be over. And if after 2 years of living through, in this country, 4 waves, we should be in a position to understand the dynamics of this virus and how to manage it. And most importantly, as government, our role is to ensure that we balance the public health response with maintaining the economy of the state and of the nation. Now, if there are any virologists around or immunologists, you will want to go into the science of pandemics a little bit to understand in simple English what the virus is always trying to do. The virus is looking for opportunity all the time, and it will search around and look for a community that is unprepared, either in terms of its public health response or in terms of boosting the immunity of its population. And when it finds a population like that, it will circulate within that population, and the virus, as it moves from one person to the other, is never the same. it always changes its structure. It's always adapting. It's always looking for opportunity to continue living and to continue to do what it knows best, which is to infect people and cause damage. So I just think that while we should know how to manage COVID by now, and we should be able to be living with COVID, we can't drop our guards completely because we're still vulnerable.
Thank you. Let me move to Debo and ask him what is his own take on this.
I think for one, I just have to agree with my seniors in the space. The real thing that is important for us is just adapting the behavior that will protect us. If we do not start to oppose the sort of behavioral trends that helped us to keep the infection rates low, we might be in for another wave, another set of, should I say, crisis-like situation. We still need to keep masking up, hand washing, and crowd control as high as we can.
As painful as the loss was for us as a country, for the people who passed, did it lead to really more favorable policies for the healthcare system? Did it lead to higher levels of investment? Did it have a silver lining at all that we can all hope on and that we can look to the look to the future with and say, look, at least we got that, at least it made us better prepared? Do you see anything at all? I'm going to start with you, Dr. Johnson, you're in the private sector here. So do you see anything at all that came out of this COVID that improved Nigeria's healthcare system?
I was waiting for Prof then. So now to stay on my own. Well, yes, good and bad, but a lot of good. Now, for me, in my own practice, we do cardiology. During COVID, all the VIPs and rich people who used to go abroad for healthcare couldn't go abroad. So they were stuck with people like us. And I think, not just me, but a lot of other specialties, they were pleasantly surprised that services did exist. And that's the one thing I want to emphasize. Healthcare in Nigeria is not as bad as the reputation it has. It's actually a lot better. I can tell you that over the past 15 years, 10, 15 years, healthcare has improved dramatically. We do knee transplants, hip transplants, open heart surgery, kidney transplants. These things were not available 10 years ago. They're all available in Nigeria and done at high quality. So a lot of people found out that these services did exist. So it helped the private industry quite a bit. In fact, I'm sure it helped the teaching hospitals as well. So people were more aware of the services. And the other thing I found out is that there is a lot of money coming into healthcare now. A lot of foreign money coming into healthcare. I think they've run out of choices in the developed world. So they're looking to see Nigeria's 200 million population and see big opportunities. So there is a lot of foreign investment, big money coming into Nigeria. Even me, people offered me loans that when I came back to Nigeria, I begged for 10 million naira loan. Nobody gave me a loan, no bank. Nobody, they wanted collateral. I said all my collateral is in the US. They didn't care. I just managed it myself. But now people are offering you loans that you can't pay back. So there's money being given to healthcare. And that is a very good trend. So we're going to be able to build the infrastructure for healthcare, new machines and all the toys we play with. But there's one part that has gone the wrong way. It's this exodus of professionals. Now that's not the fault of COVID, but COVID sped it up, I think. And I must admit, I left myself when I was a doctor. I was one of those who left, but it wasn't as bad as it is now. Now everybody is going. It is going to be very difficult to sort that problem out. And this is going to require a lot of things, including government. I think this is going to require the government leading the way. We've got to find the healthcare system cannot be excised from the economy. If the country is going backwards, the healthcare system can go on its own. But we have an opportunity now to reverse medical tourism. We do. We just have to figure out this exodus of professionals. And it also goes to show that those of you who said Nigerian doctors are bad, our nurses are bad, maybe they are hustling for them in the US and UK now. So we are not that bad. It's just the perception over time that has given us that bad reputation. But once we figure out the professional part of it, and I think technology is going to help us there. I had an argument with my partner yesterday. We had a sick patient. And I said, look, the specialists who can help us are not in this country. Let's call somebody in the US whose specialty it is, and let's do it by telemedicine. He said, how can they do intensive care by telemedicine? I said, of course you can now. What is it? Maybe you video the patient, look at the labs and all, and true enough, we did it. We don't have the we did a WhatsApp telemedicine and Zoom, but it works. So with technology, we're going to find a way, and once we get back on track with healthcare in Nigeria, I can assure you it's probably going to be the first business sector that's going to be bringing in foreign exchange. Excellent. So I'm quite happy about how the pandemic hit us in one way, but I think there's progress.
I'm going to call on Dr. Adetifa, and I hope technology will not let us down now, because his contribution to the earlier question would be highly appreciated. I'm going to combine the two questions together. So in terms of health behavior, what positive health behavioral changes has he, from his position, observed? And how can we reinforce those positive ones? And also, what silver lining does he see? Is there anything that has occurred to the Nigerian healthcare system that we can call a silver lining of this whole COVID-19 pandemic?
So, unfortunately, given the weaknesses in our vital restriction system and the like, we actually have not been able to get a sense of what the associated excess mortality has been as a consequence of the pandemic. And I'm talking about not the people who died directly from COVID, but people who died as a consequence of either limited access to the healthcare system, or even the fact that the healthcare system, both financial and human resources, were diverted to the pandemic response. We know that routine immunization of essential health services like routine immunization and family planning and the like were not as well accessed as they should have been, and where attempts were made to access it where access was not possible. And actually now we are seeing the consequences of this, because I know people don't necessarily pay attention to things that don't affect them all. We've got measles outbreaks across the country now, we're seeing yellow fever outbreaks. Some of this will be concentrated in one part of the country, but actually as a whole we are failing because all of the previous attempts we had, the efforts we had to close these gaps were disrupted by COVID, and now we are seeing the consequences of not being able to continue those actions, and now having to respond as states or as federal government, which is more expensive. I listened to a lot of what the panelists say, and I just thought I needed to remind us that this event is organized by a healthcare management organization, and most people who work in the private sector. We need to be careful of the elite trap. The majority of Nigerians do not have the experience that has been described. Okay, so as much as people were sensitized and took on a lot of the important things with respect to their behavior in relation to health, I think the continued challenge of access to healthcare in well-functioning primary healthcare centers, or indeed the the concept of universal healthcare, which is people being able to access healthcare without thinking about having to pay, has continued to be a challenge for the majority of Nigerians who are not as well off as a lot of people are able to access the private healthcare sector, and therefore they've not benefited as fully from some of the opportunities that they are leveraged in terms of healthcare in the private sector. So the telehealth and the like. But having said that, I think the lesson going forward is the pandemic exposed and very cruel a lot of the weaknesses in the health system. And the first step to assuring our health security and even assuring that we have a resilient health system is to ensure that our primary healthcare system works. And I'm pleased that this week there's going to be a primary healthcare conference that will highlight government's renewed prioritization, renewed commitment, renewed investment in primary healthcare as we continue on the journey towards ensuring that there's universal healthcare. Every Nigerian, including the proverbial common man, can walk into a hospital and get services.
Thank you very much, Dr. Adetifa. So I'm just going to give us all an opportunity to talk about how we're doing that with technology in our various spaces. And I'm going to start with Dr. Debo.
Thank you very much. I think before going into it, I think the major thing to point out in healthcare is that being a service, we face the problem of whatever we create has to be consumed at the place where it's created. So healthcare has a service generation problem as well as a distribution problem. And that is where the tech really comes in. Fortunately, because of COVID, we've seen a very significant rise in funding to health technology startups. Since COVID, we've done over $60 million in funding to a host of companies in the space, mostly focused on the distribution. And if we break that down, we're seeing distribution along the lines of distributing financial risk protection products like insurance or similar products to that like health plans. We've seen the increase in molecular diagnostics capacity, like Dr. Adetifa said. We're also seeing a change towards using data as a way to plan services. And that's the area where I feel we need to significantly double up on. And why I say this is, as I earlier said, there's a service creation problem and there's a distribution problem. The distribution problem is focused on making sure that the people who need the services get the services when they need them. While the service creation problem is really a problem of waste. I'm going to use First Cardiology as an example. First Cardiology has the capacity to deliver cardiac services that you would typically travel to the UK or the US to get to. But if we delve into the capacity utilization at First Cardiology, we would see that we're barely scraping the surface in terms of allowing people to actually consume. Maybe the term allowing isn't the right thing, but getting people who would actually come to consume those services. And that's where there's a big gap. And the more health tech companies that can come up to say, this is what the data is saying, this is what people want, these are the prices that they want it for, can we get this amount of capacity at this rate so that we can go and distribute to people and increase the consumption, then we start to see some changes. The other aspect to look at is the fact that many people would typically not come to healthcare. And we need to start looking at ways to overcome this shortage of healthcare professionals by introducing policies that strengthen our tax shifting abilities. We need to take it, especially at the primary healthcare level. We need more, community health workers, more community-based services that would close that gap between hospitals, the primary healthcare clinics, and the people. if we don't have community healthcare workers going from house to house, patient to patient, building that trust and collecting that data from them, then it becomes very difficult to plan. Like, how do I know where to situate the next ultrasound scan, or even if you take it to a tertiary care level, how do I know which of the general hospitals that we want to set or earmark as the place for knee transplants, and how knee replacements rather, and use that information to say, okay, these are the number of people with arthritis that we are seeing from the centralized data collection, and X number of those people are eligible for transplants. We need to now create transplant units that would help us, do these replacements as needed. So there's still a need to formalize policies around data aggregation, formalize policies around EMR uptake, formalize policies around actually tracking the events that we're seeing on telemedicine. Because again, most of the telemedicine that we're seeing isn't the telemedicine the way it's being designed by our step growth. Telemedicine, from my point of view, is create a platform. As the doctor is seeing the patient, they can input the data. But what is happening in reality is that doctors are having to use WhatsApp, they're having to use phone calls, they're having to use Zoom to do these consultations. And in some cases, they're not very close to their EMR where they can input the data from this consultation. So you see a lot of paper documentation from these encounters that don't directly translate into aggregated data. And without the aggregated data, it's almost impossible to plan. And I'm sure this is something that you experience at Avon as well, where we need to be able to forecast how many ultrasound scans are needed by the population that we are covering next year. How many cervical screenings are needed by this people, such that the purchasing can change. And if we see, I'm very big on the work being done by last mile neighbors. And if we see the trends there, they're using that data to make informed decisions. And this is pulling in the likes of the banks to come in to support strategic purchasing. If I know that these are the number of people under LASHMA that require dialysis, then we can make an informed decision whether we want to include dialysis under the plans and work with banks to scale up that purchase. Because for me as a provider, if you come to me at the beginning of the year and buy 10,000 slots of any service and pay me up front, even though you get it for cheaper, it already covers a significant amount of my cost for the year. And then I can now start to figure out how to leverage retail to make my ends meet. Without that data aggregation, without us actually using the data, because one thing to aggregate is another thing to use it, we probably wouldn't move the needle more than we currently are doing. And most of the focus to date has been in the formal sector. Formal sector insurance is moving. When you step into the markets, the informal sector, although there's an aversion to insurance, maybe it's a case of repackaging it based on what they would prefer. We can see that there's still a lot of work to do and a lot of potential profits, social profit looking at it. We can gain from actually going after data first. Technologies, hopefully, we could potentially do that.
Thank you very much, Dr. Dylan. We're coming to the end right now. I believe our time is actually up. But just before we move on, I'm going to summarize my takeaway from what has been said so far, because technology has featured in almost all the contributions that our panelists have made today. And the key thing is, one, the building the right platforms robust enough. So when we say telemedicine, it's not just about just making the call and having a virtual consultation, it's everything else that goes into that. The electronic medical records that are part of telemedicine, the ability to also integrate the key players across the healthcare value chain. So not just consultation, but treatments and diagnostics, etc., are all linked to a platform. That's how we get the best out of telemedicine. It's also implied there's a lot of remote tools being used now for delivering healthcare services to places in the hinterland, remote areas where doctors and maybe even task workers are able to reach more effectively. So when the task is shifted, you can enable people with digital tools that give them access to higher level medical professionals, and they can have these consultations done virtually. Those are all ways in which I believe technology can enhance the healthcare system we have now. I'm going to yield to Prof. Honorable Commissioner very quickly, if you have anything to add to us on the technology part of things.
So, COVID was Lagos State government had a strategy towards technology, introducing technology into the health space. And then COVID came and forced our hand to move much faster. While a COVID-like situation is called a biosecurity threat, which means that it needs to be managed by the government. So the government always manages a crisis that is a shock to a system. So we quickly realized in government that COVID was going to overwhelm us. And it was in the first wave that we made that realization. And it did two things. It made us change our policy very quickly. And the two policy shifts that we made early on through the incident command structure was, first of all, to change our management of COVID into the community, because we were diagnosing more people than we could possibly look after in our isolation centers. We would need to be building one isolation center every day to cope with the numbers of cases we were seeing. So we moved very quickly to a home-based care. And a home-based care required digital technology. So we pulled on the private sector space that had already developed this virtual consultations. And we set up what we call the Eco-Telemed, which we managed almost 80% of COVID in Lagos through virtual telemedicine. The second thing we did was we realized, again, because of the numbers, that government or the public sector was not able to manage COVID on its own. So we invited the private sector in. And as about the third and fourth wave, I can say that at least 70% of Lagos State's COVID response was outsourced to the private sector, generating a huge COVID economy, COVID response and management economy. So while the Lagos State economy was suffering on the one hand from a drop in entertainment and things like that, it was booming
The healthcare side.
on the healthcare sector and the digital space. So we did that kind of use, and Lagos State's COVID response was purely data-driven. Every day, the incident commander gets a report at midnight with the data of the day. And if he feels like calling me, he does. If he doesn't, well, we'll discuss it in cabinet. But usually, I'll get a call around 12:30, 1 a.m. What's going on here? What's happening here? What are you doing about this? This data is looking a bit worrying. What are we going to do about that? And so real-time data, which was the benefit. I don't know if Lagosians really understand how much data we used in driving the Lagos State COVID response, and it was a beautiful combination between public and private sector, using digital technology and creating an economy that didn't exist before, that helped Lagos not only sustain the response, but drive the economy at large. And you see, it's not just the COVID economy we're talking about. If the private sector is the response in Lagos, it keeps the economy open. That way, you're allowing billions and billions of naira transactions. So when you think about it, the advantage of driving the COVID response into the digital space and using the private sector created a billion naira open economy scenario. And that's, I think, the true value of good governance.
Yeah. Thank you very much, Honorable Commissioner. This is really interesting because thinking about this, that means we already have digital platforms, interconnected systems in Lagos State, and I guess across the Federation as well, that are the foundation for future leveraging technology to improve our healthcare system. And on that note, I know Dr. Adetifa has to go very quickly. He told me he will be leaving at about 12 o'clock. If you can give us his final comments before he departs. Dr. Adetifa.
Okay, so thank you very much for the question. Yes, the COVID presented an opportunity where, in addition to highlighting the gap about provided the opportunity for the deployment or expansion of the deployment of digital tools for what we do in the area of surveillance. So we're not, the NBCC is not a service provider, so we are a public health institute, but one that needs to have access to data to be able to make plans to prevent or respond to any public health threats. So in terms of digitization, our surveillance tool and database is entirely digitized now. In recognition of the need to ensure that we make the best use of data and to get that data in real time, we have undertaken digitization projects to make sure that all of the surveillance databases can talk. So we're not only interested in what happens in the human sector, but we take a One Health approach where we're supposed to deal with human health, animal health, what's going on in the environment, climate, and all of that. And to be able to ensure that all of these data sources stick together and show you what's going on in real time so that you can plan and respond. That exercise in digitization is going on at the moment to ensure interoperability, to ensure communication, to ensure that we have a dashboard that allows for quick understanding of the data and response. In addition, we are increasingly learning how to deploy tools to ensure, so in the area of big data, to ensure that we are able to actually forecast disease plan responses, as the case may be. So we are using GIS, map modeling, big data approaches. All of these are both requires statistical methodology and as well all of the associated data technology to put them together. In addition, the other application of digital tools in our perspective, of course, is in the whole management of the supply chain and logistical management that the honorable commissioners alluded to. And we have to do that, looking across the nation, be able to make assumptions about quantification of essential commodities, about utilization, about deployment and that. These tools have served us very well in this area. Of course, we now know where the gaps are, and working on the improved iterations of these tools to hopefully have deployment, not just at national or state level, but again, the larger vision to get all of that done to the facility level so that we have one ecosystem that allows us to do the things that we do with the highest level of efficiency possible. I think that's what I've written down. Back to you.
Thank you so much, Dr. Adetifa. So final comments now, Dr. Johnson.
At my convention, I went to Turkey last month. I saw how they changed their healthcare. And one of the most important things they had was data. Now, data collection is critical, all right? So they used data to figure out what they needed to do and where they were weak. But they also make their own CT scans. They make their own MRIs. From the same big companies, GE, Siemens, those people have factories there that they make them. So they're able to get these things at a much lower price. So what they can buy in Turkey for 10 naira, in Nigeria it will be 10,000 naira. Just because we don't make anything, everything has to be imported and all that. But technology is critical. We, in our small place, we use EMR. It is critical. The EMR is not just that you type into this system. You can get your data. And you know what is going on, and you know what you need to get or what you need to improve. And so, in summary, there's no way forward without leveraging on technology. And unfortunately, people like me, we're already getting old, so we have to rely on the young guys who understand the new technology that's coming around.
Thank you so very much. I just want to say a very big thank you to all the panelists. It's been a very interesting one. I expected no less with the distinguished panel that we have here, all highly regarded experts in their various fields. So right from Dr. Adetifa to the Honorable Commissioner, Professor, we are very grateful. Dr. Johnson, thank you very much on behalf of Avon HMO as well as Debo, my goodness. Dr. Debo, there's no gray hair, that's why. On behalf of the Nigerian-British Chamber of Commerce, I'd like to extend our warm appreciation.